are in listen-only mode.
Hello, and welcome to the Center for Fostering Success Best Practice, Best Fit webinar series. I'm Carrie Ward, Sustainability Coordinator for Fostering Success Michigan, and I'm filling in today for Dr. Yvonne Unruh, Director of the Center for Fostering Success, who was unable to be here. Thank you so much for joining us. Our mission at the Center for Fostering Success is to improve college graduation and career achievement rates among youth and young adults ages 12 to 25 years old who are aging out of the foster care system. We're excited to bring you this webinar series called Best Practice, Best Fit, which focuses on providing helping professionals, students, and supportive adults discovery-driven solutions related to educational attainment for students from foster care. Before we get started, I want to go ahead and thank our funders, the Kresge Foundation, the Havermill Foundation, and Western Michigan University for making all of our work possible. Today, we are pleased to welcome Dr. Amy Salazar, who will be focused on supportive relationships on the path to post-secondary success. Amy M. Salazar, MSW, Ph.D., is an assistant professor in the Human Development Department at Washington State University Vancouver. Her work focuses on developing and testing interventions designed to improve the outcomes of youth in foster care, and especially those transitioning from foster care to adulthood. Welcome, Amy. We're so glad to have you here once again doing a webinar for us.
Thank you for having me.
So I'm actually just going to turn it right over to you.
Okay. Okay, so hi everyone. Thanks for joining in today. So the first thing we're going to do as our first activity, we're going to try out a little activity. So we're going to try making a word cloud using words that you text in. So for those of you with a smartphone and texting capability, if you could just go ahead and text what you see on the screen, the Amy Salazar 102 to the number 22333. Then it will let you join into our texting group. And I've used this in other settings and have been told you will not start receiving spam, so don't worry about that. And I'll give you about 30 seconds or so to do that, and you should receive a text in response saying that you've successfully joined the group. And no worries if you don't want to participate in this or it's just not working for you. So I'll give you about 30 seconds to join.
And so the question is, who was the person
I was
supportive of you?
I was just going to let people join the group first, just so they can get it, because you have to join the group before you can actually respond to the question. So once you're in, I want you to take just a couple of seconds and think about the person who is the most supportive of you as you went through your post-secondary program. Or if you haven't yet gone through a post-secondary program, just think of the last time you were in school and who was most supportive. And if you can, please don't use their name, just say their role, like for example, neighbor, foster mom, or something like that. And please try to keep your response to one word. If your response is more than one word, like foster mom, for example, it'll break it up into 2 words. So just write it as one word. Just take out the space. And if you could just text that one-word response, again, to 22333, then we'll start making our word cloud. And I'll give you about a minute to think about your response and go ahead and text that in.
I know we've got some people in the office who are trying to text things in, and I'm not sure that they're showing up. So we may be having some tech issues, which sometimes happens with all these different platforms, but hopefully we can get this to work. Word clouds are super cool. So.
do you think we should
Yeah, let's
move on?
go ahead and close this out because it doesn't seem to be working the right way. Apologies. And thank you for your patience. So I think we were also going to do a poll related to the person most supportive of you in college, right?
Yeah, so this is a question about the different ways that that person was supportive of or most helpful to you. So there were 5 multiple choice responses. Yes, so thinking about the person that you were texting in, just think about which ways that person was most helpful to you as you were moving through high school or college or whatever the most recent type of education was that you were moving through. And go ahead and select your response. I'll give you about 30 seconds to do this.
Are you able to see the results, Amy?
No.
Okay. So let me know when you're ready for those. It looks like about 50% have voted so far.
Okay.
We're at about 75% voted. And it looks like 33% emotional support and checking in, 11% helping figure out complicated rules, and 56% all of these. So
Okay, great. Yeah, so I think that's really pretty common that you find those people that are key and really helpful and supportive, and they're really able to help students out in quite a few ways. So thank you for participating in those polls. Sorry we weren't able to get the word cloud to work, but maybe we'll try again at the end of the presentation. Okay, next slide.
is that the correct slide? Can you see it?
I still see the quick poll.
Oh, okay. I was on research questions, so. I'm hoping that you can see today's research question.
No, I still see the quick poll, sorry.
Okay, there we go.
Okay, there it is. Okay. So today I'm going to share with you a study that I recently completed that through the course of developing a post-secondary access and retention intervention looked at how to incorporate supportive relationship elements into post-secondary support programs for youth coming from foster care who are interested in pursuing higher education. So in addition to learning about different ways to infuse relationship building into a post-secondary support intervention, you'll also today have the opportunity to learn about the intervention itself, which I'm calling Fostering Higher Education. So the research question that I'll be aiming to answer today is, in what ways can supportive relationships be infused into post-secondary support programs for youth transitioning from foster care? Okay, so the intervention Fostering Higher Education I developed this through a study funded by the National Institute on Drug Abuse. And the goal of the project was to develop a comprehensive post-secondary access and retention intervention for youth coming out of care using evidence of best practice and community stakeholder feedback. So currently, there's very little evidence. There's quite a few programs out there that support youth in pursuing their post-secondary goals, but we have very little evidence for what programs are really effective at improving the post-secondary outcomes for youth in care. So that one of our goals of this project was to develop a project that we could then test its effectiveness to try to create an evidence-based practice for improving post-secondary outcomes for youth in care. So in this study, I used a six-step intervention development process that included input from youth who had been in foster care, social workers, college personnel, independent living program providers, and researchers, plus the scientific literature in this area. So as part of this development process, we collected recommendations for the intervention content. And we also tested the intervention usability with youth from CARE and its implementation feasibility with independent living programs, social workers, and college personnel, sort of the organizations or places that would be most likely to implement a program like this. So as we move through the intervention development process, the key importance of including meaningful relationship building into every intervention component really came through over and over. So today I'm going to walk you through our Fostering Higher Education Intervention Development process and point out how feedback from our community stakeholders, youth in care, and research and practice experts really confirmed the importance of having an intentional relationship building focus in post-secondary access and retention interventions, and also how it informed how we went about weaving this relationship building focus throughout our program. So in our first step, our first intervention development step, based on our knowledge and reviews of the literature and our combined research and practice experience, we decided that it made sense to include intervention elements that lent themselves well to both meeting a wide variety of youth needs and also having a heavy focus on the importance of the relationship between the interventionist and the youth. So this, along with the promising evidence for these types of intervention elements, led us to choose professional educational advocacy and mentoring as our two primary intervention components. Both of these approaches call for long-term commitments from educational advocates and mentors to connect with youth as they make progress toward and through the post-secondary educational program. So in addition, these intervention approaches can be highly structured, which is often important for an intervention to be if the goal is for it to become an evidence-based practice, which for us it is, while at the same time being really flexible in how they can go about supporting youth. So we knew that we wanted to deliver, in this intervention, we knew we wanted to deliver some potentially sensitive material. For example, we wanted to include elements of alcohol and substance abuse prevention because this can be a big pitfall for college students, as we know from the literature. And it can be an especially sensitive topic for youth coming out of foster care whose parents might have struggled with alcohol or substance use. So we wanted those sensitive components to be delivered by someone who the youth had time to bond with and meet with regularly before we really got into that more sensitive part of the intervention. We also already knew at this point, at this first step in our intervention development process, that we wanted the program to bridge the transition from high school or a GED program into higher education, because most programs only focus either on accessing higher education or being successful once you're already in higher education, but not usually both. And that transition period can be a key time when youth need continuous support from caring adults. So in our second step of our intervention development process was focus groups. We convened 37 community stakeholders from child welfare, independent living, local colleges, nonprofits serving youth in care, as well as youth themselves aging out, to give us recommendations for what they thought was key in designing an intervention to support youth transitioning from care and accessing and being successful in higher education. So we held 4 groups, 2 in Seattle and 2 in Portland, and we recorded and transcribed the focus groups for use in our analysis. So the demographics of our participants, 10 out of the 37 participants were youth. Females were overrepresented in both the youth and professional groups, and a large percentage of participants decided not to report race or ethnicity. So the importance of intentional relationship building was made really clear throughout all 4 of our focus groups, And this table reviews some of the key ways that this came up and how we then incorporated those recommendations into our intervention. So, for example, the first focus group finding listed, which is incorporate cohort or group elements. The way that we then translated this finding into our intervention was we had already decided we wanted to include one-on-one mentoring, but we then decided to also have a group mentoring component to give youth the opportunity to connect with other higher education interested youth coming from CARE that had those similar backgrounds. Another recommendation that emerged was helping youth expand their social network and supports. So again, the way we included this in our intervention came also through the group mentoring piece, which allowed youth to connect with a lot of other post-secondary experienced adults, so the other mentors that were mentors for other students in the program. Another recommendation that emerged was building relationships with intervention staffs and mentors. So from this recommendation, for our intervention, we developed initial and ongoing training modules that taught all of our different staff, the educational advocate, the mentor coordinator, and the mentors, and how to go about building intentional relationships with youth. Another recommendation that emerged was the importance of including natural supports, people already in youth's lives, when possible. So from this recommendation, we decided that we would prioritize students identifying natural mentor, people already in their lives, to be their mentor. Really the only criteria we have for who can be a mentor is recent post-secondary experience. So if they had someone in their life who could already do that, then that could be their mentor. And then if there was no one available, then we would find a community mentor for the youth. So the next recommendation that emerged was that those interacting with you should use an empowerment approach. So to address this, we include youth empowerment and strengths-based youth work modules into our training components. And finally, another recommendation was that sensitive material, like I was mentioning, bringing up college alcohol and substance abuse prevention and things like that, should be delivered in a really skilled and strengths-based way by someone that the youth trusts. So we actually did a lot of thinking around this to make sure that we were delivering the content in a way that wasn't triggering to young people. So we decided to present substance abuse material in particular as a risk for all youth, not just youth in care, as is the case, as we know, for youth going to college. And that the delivery really needs to be intentional, well thought out, and sensitive to the past experiences and potential triggers of youth in care. And to only present that sensitive material after the youth and whoever's presenting it have had time to establish that relationship. So quite a few ways that the crucial relationship building piece was really brought up by our community stakeholders and in turn integrated into our intervention approach. So in our step 3, which is develop the initial intervention approach step, we started getting a lot more specific in what we wanted each piece of the intervention to look like, with input from research and practice professionals, as well as youth transitioning out of foster care, and the information we collected in steps 1 and 2. So in order to give a context for the remaining intervention development steps, I'll just give you a quick overview of the Fostering Higher Education intervention design. So Fostering Higher Education is a 2-year intervention. Starts late in the junior year of high school or while students are in a GED program, and goes through the first semester, 2 quarters of a post-secondary program. This is a support program for any kind of post-secondary educational goal, not just 4-year college. And in all intervention components, intentional relationship building is key, and staff and mentors are trained on this, and it's incorporated into all activities. So there are 2 primary sets of activities, those that are implemented by the educational advocate and those that involve mentors. So the educational advocate implements 2 activities. The first is called the Higher Education Goal Planning Procedure. And this is just an organized way of approaching college planning. So in this procedure, the educational advocate and the student identify educational goals, They create to-do lists to accomplish each goal. So for example, if a goal is to apply for college, the to-dos would probably include things like reviewing the application components, collecting recommendation letters, taking standardized tests, and things like that. And it also identifies youth strengths and does planning around potential obstacles that are unique to each youth. The second element that the educational advocate provides is a curriculum that we developed called the Top 6 Potential Pitfalls for a Higher Education Curriculum. So this curriculum that we developed addresses the most common pitfalls that college students face that can get in the way of their academic process. And this is based on the college dropout literature, in particular the American College Health Association's National College Health Assessment, their top impacts on academic performance, as well as the literature on foster care and higher education. So these top 6 pitfalls that we identified were sleep, physical health or getting sick, mental health and stress, financial challenges, relationships, and alcohol and drug misuse. So the module for this last piece, alcohol and drug misuse, is adapted from the BASICS evidence-based college alcohol prevention program. So this curriculum informs students about these potential pitfalls, sort of what we know based on the science. It helps them think about where they're at in relation to each one, and also do any planning they feel is appropriate to make sure those factors don't become pitfalls for them. So the educational advocate will implement both of those components using the most motivational interviewing approach, through which information is delivered in an empathetic, non-confrontational, and non-judgmental manner. So for the other side of this, mentoring, we include, as I've said already, a one-on-one and group component. And mentors can be natural mentors or community mentors. They just need to have recent post-secondary experience. And the one-on-one mentoring piece will allow for a close relationship between the youth and the post-secondary experienced mentor, while the group piece will allow for social network building with both youth with similar experiences who are college interested and post-secondary experienced adults. So in our next intervention development step, theater testing, we tested the usability of the intervention with youth exiting foster care to see if they actually liked it and if they had recommendations for strengthening it. So we had 2 theater tests, one in Seattle and one in Portland. We did these with 13 youth with foster care experience. Each group was about 4 hours. In these groups, we tested 4 pieces of fostering higher education. So we tested that higher education goal planning activity. We tested the sleep module of the pitfalls curriculum. We tested the substance abuse module of the curriculum. And then we also tested the mentee intake process. So for the theater test procedure, we had youth role play. How those work is we had youth role play in each activity for about 20 to 30 minutes with a trained staff member. And then after they did each activity, we had them then fill out a brief survey about each activity to say what they liked and what they would do differently. And then we convened the youth together to discuss each activity and give recommendations. And then we did that process for each of the 4 activities. So I'm going to share with you some of our theater test findings, those relating most to the relationship building piece. So for the higher education goal planning activity, these are some of the quotes that we gathered from the brief surveys and from the group discussions. So for the higher education goal planning activity, youth really liked clarifying the steps that they needed to take and having that caring adult to sort of help lead them through that process. And they also really liked having caring adults listen to them and challenge them on their plans and their thoughts. So for the substance abuse, we didn't have a lot of feedback that was relationship focused for the sleep module, so I'm skipping that one. But for the substance abuse module, the thing that really stood out to me for this activity is that students really insisted, which was different from what we heard from the adults, from the professionals in our focus groups. The students really insisted to not shy away from sensitive topics like substance abuse, but just to talk about them in a way that's informational, really intentional and well thought out, and in a way that helps equip youth for avoiding things that could very possibly become a pitfall for them, rather than just avoiding the topic because it could be a trigger. Just being really, doing it really skillfully and after a relationship has been developed. So the fourth activity, we couldn't really have youth role play hanging out with a mentor, so instead we had them role play the mentee intake activity, which included exploring the options that a youth had in their life for a potential natural mentor, exploring their preferences for a community mentor, what characteristics they'd want that person to have, and then clarifying the mentor-mentee roles and expectations. So for this activity, youth really liked being able to identify the preferences they had for their mentor, and one recommendation they had is that interactions with mentors were really casual, long-term, which is supported by the literature, and that mentors proactively show that they care about the youth that they're working with. So in our next step, which is feasibility testing, so in this step we presented our intervention design to practice professionals from the sectors that would be most likely to offer an intervention like fostering higher education. So we're thinking this would be independent living programs, child welfare, local colleges, settings like that, and nonprofits that serve a lot of these youth. To get their feedback on how feasible it would be to implement fostering higher education. So there's not a lot of this from this step related specifically to enhancing or incorporating relationship building. However, respondents really rated all of the intervention elements as both important and feasible to implement. One note of that from that though is that the mentoring components were seen as slightly less feasible given the time and oversight commitments that are required for successfully running a mentoring program. However, they were still rated as feasible. So it's important to consider, these questions of feasibility, of course, because you want to be sure that you're offering something that's actually going to work for communities, or that you're developing a program that's really going to work for communities, and also be ready to do planning around potentially challenging elements to implement. Let's see. Okay, there we go. So in our last step, finalizing our intervention design, here's where we manualized the fostering higher education approach, and we also developed a comprehensive set of training materials for delivering fostering higher education. So there are several relationship building recommendations that emerged from this study. I just tried to summarize some of the key ones here that I felt really stood out. Things like including group or cohort elements, training staff on how to intentionally build relationships with young people, considering the feasibility of integrating relationship-based components and having a really good strategy for making sure that including those elements is feasible. Not shying away from talking about sensitive material. This is one that came up for us quite a bit, sort of that question of how do you bring up this kind of material in a way that's helpful and not triggering. So not shying away from talking about sensitive material, just being really skilled at how it's delivered. And then finally including natural supports when possible, because as we know, these youth have a lot of people coming in and out of their lives. So trying to reduce that and use people they've already built relationships with can be really helpful. So these recommendations can, just like in our program, they can similarly be used in other post-secondary access and retention interventions for youth in care. One of these that really had an impact on me, as I've said, was that piece about students speaking to the importance of bringing up sensitive topics, like substance abuse, in an intentional way that really helps equip youth for avoiding things that could become a pitfall for them rather than avoiding it. And another that really stood out to me is the importance of doing relationship building with any and all professionals who will be interacting with youth prior to them embarking on any sort of substantive material. Okay, so for next steps, I'm now in the process of applying for funding to test whether fostering higher education is effective in improving the post-secondary access and retention outcomes for youth in foster care. So I'm hoping to be able to continue this work and to continue to build the evidence base for these kinds of programs for youth transitioning from care. So we were going to do one more word cloud here. Why don't we just try it out and see if we can make it work? Carrie, do you want to give that a try? See if we can make it work? Okay. So while this is opening, if you're still texted or if you're still in the group, which you will be unless you texted leave, what I'll have you do this time, and we'll just see if it works, is think back to that supportive relationship that you defined in the beginning, whoever that happened to be. And I want you to think of one word. Oh, there's our word call from earlier.
Yay!
Oh, it looks like it just went to the next. So so this was our word cloud that you all texted into earlier for those people that were supportive in your life. So we had counselor, best friend, parent, coach, mother, husband. So a lot of different people that were offering that support. So now what I'm going to have you do, which it might just keep adding on to the same word cloud, but I think that's okay, is to think of one word that describes how that supportive relationship made you feel. Just one word. And so I'll give you about 45 seconds or so to text in your response for that.
Also, I want to mention as we're waiting, we'll be taking questions, and so if you have any questions that have come up, go ahead and type in your questions in your control panel on the right side of your screen. Just click on questions and go ahead and send us your questions.
Okay, so it looks like we have a lot of different really wonderful ways that we've all been helped by those supportive adults in our lives as we've been pursuing education. So feeling supported, feeling motivated, having listening, having feeling capable, feeling relieved. So a lot of different ways that these people have really made us feel like we're able to really move successfully through a post-secondary program. So we're really hoping that some of our strategies for infusing relationship building into post-secondary programs will help foster some of these same feelings that you've entered here in youth leaving care as they're pursuing their post-secondary goals. So thank you so much for listening, and I think now we will switch over to question time.
Okay. All right, so we do have one question that just got sent in. How do you train educational advocates and mentors in intentional relationship building?
Okay, so we've identified several different relationship building curricula and training materials that we really like. And we picked different ones for the educational advocates and for the mentors. So for the educational advocates and the mentor coordinators, who are kind of that person who oversees mentors, we really like, there's a curriculum called Ask, Listen, Encourage that we really like. This was developed by the Weikart Center for Youth Program Quality. It includes evidence-informed strategies for building intentional, positive, and caring youth-centered relationships with the aim of increasing youth motivation and self-confidence and autonomy. And for mentors, we preferred to choose trainings that were developed specifically for youth mentoring relationships. So a couple of those are one's called Building Relationships, a Guide for New Mentors that was developed by the National Mentoring Resource Center. Another one is called Fostering Close and Effective Relationships in Youth Mentoring Programs, and this one was developed by Mentor, the National Mentoring Partnership. So the thing I think is helpful to look for is all these resources have clear recommendations and tools for helping professionals learn these skills rather than just kind of more abstract recommendations. These are also all based on scientific findings, so we like that as well.
Great. Okay, so another question. Is it difficult to recruit post-secondary mentors for youth in care?
So this is a question I'm asked pretty frequently. I know that this is a big challenge for mentoring programs, is recruiting mentors. And in my experience so far, it actually hasn't been challenging. Before doing this work, I worked at an independent living program and ran a college-focused mentoring program similar to with some of the same elements as those that I've talked about today. And we recruited mentors from local colleges and universities, for example, through the faculty and staff listservs. And we also recruited from local companies who hired a lot of college graduates. For example, in Portland, where I live, and in Seattle, where I was doing the work, big companies like Nike or Amazon, or really reaching out to some of those big employers and seeing if they'll be willing to get the message out to their staff. And we had so much interest. We heard from so many people, especially from the local colleges and universities, of people who are really interested in using their expertise, using their experiences, their successful experiences in post-secondary education to support these youth. So I think it resonates with people. They feel like they can use something that they know about and share it with the youth. So we actually haven't, I feel like this is something that people are interested in. So that's been really encouraging.
That's great. Yes, and I think mentoring in general is definitely a reciprocal relationship where, the mentor benefits and then the mentee benefits. So that's great. Could you also, there's another question, could you just offer one or two pieces of fostering higher education rather than all of the different pieces you described?
So before I recommend using any of fostering higher education, I really want to be able to test its effectiveness in a randomized control trial. So as I said earlier in the talk, there are a lot of really great programs out there that serve youth transitioning from care and support them in meeting their post-secondary goals. But in all honesty, we really have very little evidence for whether and to what extent any of them really work at improving youth post-secondary outcomes. So my goal is to test this program before asking people to put it to wide use, because I really think we should know that something works when we offer it to youth. And I also encourage other programs out there who are doing similar work to include evaluation components into your program and look at its effectiveness, so that we can really be confident about that what we're offering youth is really able to make a difference in their lives, as evidenced, for example, by improved graduation rates for youth who've participated in the program and things like that.
Absolutely. Absolutely. Okay, so I'm not seeing any other questions, but I'd like to just give it a couple more minutes in case anybody would like to type any other questions in. Amy, do you have any last thoughts or comments or anything like that regarding your study or the intervention?
I can't think of any right now. I've been really encouraged over the last few years about how so many colleges and universities have been developing post-secondary support programs specifically for youth coming in from foster care on their college campuses. So that's really exciting to me. I feel like there's a lot of momentum in this area, and that it's just a really great time to get some really good programs out there. So.
Absolutely, and some evidence-based programs too, right?
Yeah,
so
that would be ideal.
Yeah. Okay. All right. Well, let's see. Thank you so much for joining us today. If you want to view a recording of this webinar or share a recording, you can visit our website. It will be up within the next hour. It's www.fosteringsuccessmichigan.com. If you have a research study that you're interested in presenting via the series, please contact me, Carrie Ward, and my email is up there. Thank you again, Amy, for presenting for us. It's always a pleasure to have you with us. And
Thank you.
keep doing all that great work. We appreciate it. So,
Thanks.
okay, take care.
You too.